There are several key types of medications used to manage diabetes in patients with chronic kidney disease. Insulin. Various types of insulin may be used based on individual needs. Dose adjustments of insulin are often needed depending on the degree of kidney dysfunction. Metformin. In early-stage CKD, metformin may be used carefully and with reduced doses. But as CKD progresses, metformin needs to be discontinued due to the risk of lactic acidosis from metformin accumulation. DPP-4 inhibitors. These drugs stimulate insulin release and reduce glucose production. They are dose-adjusted based on kidney function. GLP-1 receptor agonists. These mimic the glucose-lowering actions of the gut hormone GLP-1. They may preserve kidney function better than some other diabetes meds. SGLT2 inhibitors. This class of drugs lower blood glucose by eliminating excess glucose in the urine, but they require adequate kidney function and are stopped in later stage CKD.